Huge thank you to CIBC for making We Get It possible. Welcome, everyone, to We Get It. My name is Karine. I am the program director with Young Adult Cancer Canada, and I am thrilled to be here today and to be in absolutely incredible company. We Get It is an episode that we do weekly every Monday, 7 p.m., where we talk about topics that are relevant to the young adult population, young adults living with cancer, but also anyone who is touched by young adults with cancer, interested, passionate about. So we have a variety of guests that come every week. And this week, out of the comfort of my own office, I am with three wonderful guests, Jackie Bender, Anika, oh, I'm going to say your last name wrong. I missed
Petrella.
Petrella. I was going to say the other one, Petrella. And Paul Silvestri is with us. So I'm going to first invite you to just introduce yourself a little bit more, and then I'll tell you what we're going to talk about just after. So Jackie, let's start with you. Who are you?
Thank you. Thank you, Karine. I'm so pleased to be part of this episode today. It's such a great series. I think so important and such a great opportunity to reach and share and discuss knowledge, health-related knowledge and practices with so many. So my name is Jackie Bender. I'm a scientist at the Princess Margaret Cancer Center in the YACCer Cancer Rehabilitation Survivorship Program in the Department of Supportive Care. Bit of a mouthful. I'm also an assistant professor at the School of Public Health and the Institute for Health Policy Management and Evaluation at the University of Toronto. And I'm coming to you from Toronto in my office, which is actually located in the Toronto General Hospital, not Princess Margaret, in the YACCer Cancer Rehabilitation Survivorship Center. So really pleased to be participating today.
Thank you, me too. And how about you, Anika?
Yes, and I reiterate that. Thank you for having us. I'm also a researcher working actually in the UK within the National Health Service at the University College London Hospital. And I'm also a psychotherapist here in Toronto, and I'm coming to you from Toronto because of COVID. I'm back from London. And so my clinical and research work has mainly focused on the management of survivorship issues faced by those diagnosed with cancer, but I'm specifically interested in the adolescent and young adult population, and even more specifically men. And I'm interested in looking at how survivorship care programming can help address some of the physical and mental health challenges after cancer.
Awesome. Thank you. Welcome back to Canada. We're happy to have you back.
Yeah, it's nice.
It is weirdly safer in Canada, I think. So, hey.
It is.
And how about you, Paul? Tell us a little bit about you.
Sure. My name is Paul Silvestri. I'm a teacher with the Toronto District School Board. I'm a trained musician. I've been playing music, writing, recording, playing live since I was about 12, 13. So that's it's a big part of my life. I'm a big fitness enthusiast, and I was diagnosed with stage 4 testicular cancer in September of 2017. And I've been cancer-free since November 2018.
Woo woo. Yes, to that. All right. Thank you, everyone. So as you can see, I am in amazing company. And the discussion we're going to have today, we were kind of talking. So I've had a variety of conversations over the last few years, maybe with Anika, with Jackie, even with Paul, about men or people who identify as male and participation in programming, so support programming like what we offer with YACC, but also in research. So today we're going to have the time to actually talk a bit about that with the perspective of our two researchers here who have done multitude of research with sometimes specifically male, but also who have had those conversations in the past. And also Paul and I this summer had started to talk a little bit about that because of course, sometimes I'm like, well, the guys we know in the YACC community are actually the guys who seek out resources, use resources, and sometimes to talk with them, they're usually really open to kind of just say, well, I'm going to try and use this and see the benefits. But we've also had some male joining our programs who said to us at first, I was not sure about that. This was not probably something I was going to do. My wife brought me, or my friend brought me, or brother or sister. And so the relationship between research and also support program and our male or people who identify as male in research, this is a conversation that I feel is not new. So maybe Jackie, can you tell me a little bit about some of the conversations maybe in the research world around that topic? Oh, you're muted.
Absolutely. The research perspective, participating research perspective, if I could, we did a couple of studies recently over the last couple of years that were really illuminating, and certainly started to pique my interest on gender differences with respect to participation in research. And so one of the first studies was a study that I led called Connect for Health, and that was funded by by ARC, an organization called ARC. And in this study, we conducted a survey of young adults with cancer. So that's actually AYA, adolescents and young adults with cancer. So those are people 15 to diagnosed 15 to 39. And we specifically recruited people from the Princess Margaret Cancer Center, and we recruited them online. And we used two different methods. So recruiting people from the Princess Margaret Cancer Center, we recruited them in person during their regularly scheduled clinic appointment. And we gave them a paper version of the survey if they were willing to participate. Whereas online, we used mainly social media recruitment strategies to recruit people online and gave them an electronic version of the survey. So overall, we recruited about 440 participants, I believe. And interestingly, the sample of participants from Princess Margaret, so those recruited in person, were about 50-50 males, females. But the sample that was recruited online had only 10%, only 10% of whom were male. So that's a considerable difference. So the online sample was 10% male, 90% female. So that really doesn't allow us to get a really wholesome understanding of men's views and perspectives when we have such small sample sizes with them. And it wasn't a unique case. So in another study, YACCer Prime study, which I'm sure many of you are very familiar with, the rate of participation of males and females was also considerably different. I think on average in some of the data that I'm working with the YACCer Prime study, the numbers were 13% of males, and 87%, 13% of the sample was males, and 87% of the sample was females or self-identified. So again, big differences. We're nowhere near that 50-50 that we'd see in hospitals when we recruit directly from clinic. And so, that was very surprising to me. And concerning. A lot of researchers now are turning to online methods to recruit participants for research, many advantages to online methods. They offer considerable reach to large populations, as well as reach to smaller, hard to reach populations. Yeah. They also offer sharing possibilities, so you can engage our sharing, our networks to promote the study. And they're also tend to be more economical than recruiting in person. But this is problematic if we're starting to see much lower numbers of men participating in online research.
Yes.
And I would sort of segue to perhaps asking the others to comment on this is also reflective of numbers we see in participation in healthcare services, support programming and services in particular. Mm-hmm. And I know we've talked about that before.
Yes. And I'll definitely want to hear actually from you, Anika and Paul. But I actually looked, so as we were preparing for our chat today, I had a look at, so YACCer keeps a tracking really of all our community members who have attended an event face-to-face and now online. And so that excludes our local life events. So for those of you who attend local life, but if you look at all our retreats and conferences, the numbers were again, to your point, Jackie, similar. So as a whole, we have 26% of our YACCers that we call, of people who have attended an event that identify as male, but that includes survivors and supporters. So I kind of went a little deeper just to see, well, actually, if I want to know how many male are supporters and how many male or identify as male are survivors, then the numbers change a bit. So we have 56% of our supporters who are identifying as male, and 18% of our survivors who identify as male. So to your point, we're seeing very similar numbers when it comes to really more supportive programs. And this has been, I would say, over the years, pretty consistent and being between 18 and 20%. So 80-20 has been our ratio for quite a while at YACC. Anything to add or to complement to that, Anika?
Yeah, I think that's consistent with what we see in the research more broadly across many age ranges with men's health, and engagement with social support. So I can say that through some of our work interviewing and engaging in both qualitative and quantitative data collection with testicular cancer survivors, so a sex-based cancer diagnosis, men speak often about their desire to help out, desire to engage, to help other survivors the way they would have wanted to be potentially engaged with when they were in that position. But it's a very one direction, right? They're comfortable, or will often articulate being comfortable with the giving of social support, but won't be putting their hand up to receive that support, which is a really interesting aspect, especially when we're thinking about young people and what we would consider that developmental stage and the impact of different health inequalities, especially at age, right, in an adult cancer center. So I think that that's spot on to what we're seeing.
Yes, and so Paul, obviously, you've used our services, and I know you've been, from the conversations we've had together since we've met you, you've been really open, but I am curious, has it always been that way, or did you at some point make a decision to open yourself up to support, connection, even research participation? Where do you stand, and how did that look in your cancer trajectory?
Well, part of my temperament is if I have a problem, like if I have to sort some stuff out, I'll just go and sort it out. I've talked to psychologists before, so that's not, I didn't feel any apprehension about doing so. I've always been involved in the performing arts, and I just so happen to be around a lot of girls, a lot of women, and so like, and there's a lot of sharing and storytelling, and that's just, I've always been involved in that. So I would just jump on stuff. I happen to be more introverted in nature, and so I don't necessarily parade a lot of information. So I'll just kind of like look and listen, and then I know that I'll get involved in something and just sort of soak it in and then give my 2 cents. But I'm also, really into fitness. I've taken like boxing and Muay Thai classes, so I understand the aggressive facet to a lot of guys, and I'm not oblivious to it. I definitely acknowledge it. I'm perfectly fine with it. So there's this like grappling, maybe not grappling, but there's this dichotomy between, the sensitive and the aggressive that I've always had as a part of my temperament. And I've always been of the school of thought of, well, I have certain traits, but I also need to get things done. And so if I have to sort myself out, whatever means that is, I'll just get it done. I tend to grab things by the horns. And as soon as I was told that I was sick, it was just pay attention to what's going on. If somebody brings up a resource, jump on it. If there's a person to talk to, jump on it. There was a study that Anika brought up, jumped on it, and there you go.
That's part of who you are. Yes, thank you, Paul. And I think there are others who are like that, and we'll dig into, we've asked some questions and we've got some answers back from some members of our community who identify as male. So we'll dig into that, but anything you want to add to that, Jackie?
I just wanted to, as you both were talking, actually, it made me think of, what we've observed in a peer navigation program that I built for men with prostate cancer and their partners. And so in that program, we match using technology, match somewhat newly diagnosed, not even, essentially men with prostate cancer with prostate cancer survivors or caregiver survivors. And so when we started out, we needed to recruit prostate cancer survivors and their caregivers to become peer navigators. And we engaged them in a training program to get them set up with the knowledge and skills and confidence to act in that peer navigator role. And we had no trouble recruiting people to become peer navigators. Within a very short period of time, I think less than 2 months, we had more than we needed. And interestingly, when it comes to recruiting men to participate in a peer support intervention like that, and it's not labeled peer support, but that's the essence of it, with some additional communications and navigational training and service-related training. There is a hesitancy to participate, hesitancy to say yes. Even though we have found this to be very helpful and beneficial amongst men. And we have found that oftentimes when people do say yes to participate, they say, yes, I'd like to help you out with that. I'd like to give back. And so similarly, it's this desire to give back and to not receive. So I'm really hoping that through this discussion today, we can start to scratch the surface on how we can make it okay to say yes to engaging in healthcare services and supportive care programming that might be quite helpful.
Yeah. And as I'm listening, I wonder as well because I think maybe it's Connect for Health, Jackie, but correct me if I'm wrong, but I feel like I'd read somewhere, and I'm paraphrasing what I'm remembering, so I could be wrong, but that people identifying as male and men in general would and search for information. They were really kind of focused on, give me some information that can be useful to me. To Paul's comments, I'll read, I'll take it in, I'll do something with this. And a part of me wonders when it comes to research, if because some still, maybe too many research still are the dissemination, the access of what is found through research is not as widely accessible, let's say, as we would want it to be always. Would that, if more male, or even more, if you want to kind of broaden the lens at what we're looking at, if more people right now are not engaging in research and support programs, had more access to the impact research has and to how it can help and change people's lives, would they be more inclined to actually participate, knowing I can help people, but this can also help me? Do you know what I mean? I wonder.
Yes, absolutely. In fact, I'll just say this quickly and pass it off to the others, but what Paul was saying, and also in reading some of the responses that you got from that survey that you conducted, I think one way to make it more appealing to participate in research is to show the benefits to others, and is to show. I was really impacted by someone saying, if there's a call to action, and then Paul saying, if there's something to be done, I'd like to get it done. And so I think even, the messaging that we use to promote research studies or to promote healthcare programs and services is incredibly important. And so I think that that made me think, if we could use more purposeful language to show how it's productive, it's helpful, that might make participating research more appealing, and it will appeal to our naturally altruistic sides, as well as perhaps a sort of problem focused, sort of direct approach to problem solving.
Yeah. Anything to add for Anika or Paul?
Yeah, I think that linking back to what Paul was saying about being in a female environment where there was storytelling and that was normalized, right? There's a fantastic paper published by Dr. John Oliffe, who is a leader in research in men's health initiatives. and so not just specific to cancer, but has done a lot of work in cancer, but mainly with older adults. And he talks about permission and affirmation, but he also talks about, so that's that normalizing and getting men engaged, getting that kind of ball rolling, for a lack of a better word. But he also talks about the benefit of incentivization, which is I think what you're touching on, Jackie. So not just that piece of engaging men to see how it may benefit other men, because we know that that would be a good strong link, but also in how it would help themselves through health gains, short and long term, right? So by engaging in something that we are claiming to potentially have benefit, how can we get their input? And then that again feeds into that cyclical help seeking and changes the narrative around engaging with their own health and also with the healthcare system.
Yeah. Any thoughts on that, Paul, before we move on?
Yeah, I agree with all of that. I like the idea that it's purposeful. So one of the things that, like, I like having tasks, and I know a lot of guys that like having tasks. And when you're on medical leave, it's like, what am I going to do? And maybe you have to go to appointments, and you have this, that, and the other. And so I would like puzzle piece things to do in my schedule, workshops, this and that. Go to the Anika study, and so a lot of us, if we're just sick, and if we're sick and we're not working, we're going, well, like, I need to do something, or I'm going to climb up the walls. And so with Anika's study, it was like, get together with a bunch of guys, we're going to lift weights for an hour, and we're going to play basketball for an hour. And it was like, sign me up,
Yeah, concrete, practical. Anika, did you have something to add?
Yeah, I think we're definitely jumping ahead to sort of how to break down some of these barriers, which I think is great, because I think the foundation of what we know and where we are, the state of things is clear. But exactly as Paul said, men connect by doing, right? So by putting a task in place, and this isn't just men, but we know that this could be something that breaks down that barrier, and allowing that shoulder to shoulder discussion, right? So discussing and engaging and connecting by doing something, as opposed to kind of the locker room effect, right? In a sports analogy, has been shown to be quite helpful. So we'll get to the breaking down the barriers, but I think all of this should be kept in mind when we circle back to that.
Totally. So talking about, like, so I know I don't know if did you have something you wanted to say, Jackie? Yeah, come on.
I'm seeing all these links. That made such a super link also with the data that you shared at the beginning. I'm just looking to my paper to make sure I wrote it down. When you said that of the YACCers, although 27% as a whole were male, the fact that 18% were survivors, but 56% were caregivers or supporters. Right, supporters is that sort of acting on helping someone else role. Not necessarily, I would suspect, they weren't necessarily participating for themselves. They were participating to support the other person. So I just see it all aligning quite well. So excited to talk about how to break some of these barriers down.
Totally. And to say, like, many of the supporters, so we have spouses, we have friends, we have cousins, many of them are spouses, but a lot of them will come to our programs first saying exactly what you said, Jackie, is I'm here for my sister, my friend, my wife. And by the end of it, when they kind of allow themselves to see what's in there for me, and because we do tailor some of our programs for them, by the end, they actually understand that, okay, it was not just about the person I'm supporting, it was also about me. But it is a message that we have to work through, because there is this kind of way, and I'm going to do a session solely on caregivers, which we get it in the months coming, because I think they go through something very different, and young adult supporters are also this kind of subcategories in caregivers when they support another young adult. So we'll dig into that, but yes, there is this kind of dual place. So I took some notes. So for those of you listening or watching, we did in the last few days, we just kind of quickly did a short survey with a few questions to our community members. And we were able, actually, in like 24 hours or less, we were able to gather comments from 10 of our male or identifying as male within the Young Adult Cancer Canada community, which is amazing considering we just did it on the fly, and got some interesting feedback. So I wrote it down, and I know you had taken some notes as well, Jackie. Do you want me to run over some of the few key, or do you want to do it? I felt like you were very articulate in your email, but
You go for it. I'll just jump in when
you're going to correct me, because I'm very disorganized. So this is what I did. So, okay. So we asked a bunch of questions. I have the questions. Let's see. First of all, we wanted to know, what are some of those barriers in accessing community kind of support through different organizations, and also help to access what can be some of the barriers, and also research initiatives. So we kind of wanted to understand where men stood in regards to that. We're not going to go through each response, obviously, but we kind of looked and saw a few kind of repetitive, I guess, things that really stood out. One of them was pride. We've seen a few many, even in our 10 sample of 10, who did mention pride as something that contributes in part, not all the time, but in parts as a barrier, even for seeking around help, trying to get some information or checking things out. We've heard some people who said, I didn't go to the doctor, even though I thought something was wrong, because I'm a guy, I got this, I was going to figure it out. And so pride was there. We had social expectations as well, which I think, Paul, you kind of touched on, and we can elaborate, like I'm going to let you elaborate on that. But you mentioned some of that, some of the stereotypes as well in our society. Norms were parts as well of some of the barriers. Lack of awareness, anonymity. So some people were saying, I don't know, where is that information going to go? Is my identity and information safe? Why would I share in that capacity? And the online piece to me comes up, like how safe people feel online. So those are some of the initial notes. Personal relevance, call to action. So I had listed those, but let's kind of dig into a little bit more. So Jackie, I'll go to you first on some of your thoughts and some of the places you would like to emphasize.
Sure. First off, thanks so much. In 24 hours to have 10 people complete a survey,
Right?
that's really great.
You got a good community.
That really speaks to how effective you are at recruiting and engaging people in your work and the participation of the YACC community. So really was impressed with that. Yeah, it was super interesting for me. I saw some alignment. What was jumping out to me was that the barriers, and I'm just looking at my notes here, the barriers for participating in health and community-based programs that seem to be similar. There's similar ones. Mm-hmm. This is speaking to this notion of pride. And I wonder what pride is. Is pride this notion of self-reliance? Is it this notion of perhaps stigma associated with not behaving in ways that are seen to be stereotypically or traditionally male? So these societal expectations of masculine ideals. And someone provided a bit more explanation there and said being perceived as weak for asking for help really spoke to me quite a bit. And then in addition to that, they spoke about other barriers to participating in community-based programming, including lack of awareness and concerns about anonymity, desire for anonymity, and concerns about confidentiality. And then that last theme also seemed to overlap with some of the barriers to participating in research, where these folks also spoke about lack of awareness of research programs, lack of a clear call to action. So what we were talking about before, of needing it to be, well, why would I do this? What's the purpose of it? Who will it help and how will it help someone? Wanting to make sure their participation is meaningful and purposeful. And then concerns about confidentiality. So that gave me at least some ideas of maybe how to improve the messaging around how to promote research projects. And then I'm really excited for Anika and Paul and Karine to be talking to you about how to break down some of these barriers, particularly the barriers that arise from these societal expectations of how men ought to behave and how they typically engage in health practices.
Yeah. So Anika, anything to add or say on these?
Yeah, and I think it's an interesting order because I think, Paul, you're going to be able to just correct us on your experience, right? After Jackie and I have
about it.
rambled on about what we saw in the research. No, but I actually like it. I think that a lot of what we saw in the response path was, you know, it's actually going against a lot of why we're coming together to talk about this. I mean, men spoke up, they shared their opinions, which is really interesting, but they're also showing a lot of those barriers. So that gives me hope that men want to engage. I mean, if you looked at the question where we asked, would you be interested in participating in tailored programming? And we didn't go as far as to say, you know, for men. We just said if it was tailored, if it was, you know, targeted for you, would you be more likely to participate? And, you know, the vast majority said yes, and the rest said maybe. So there wasn't a no, which is fantastic to see. And I think that speaks to the interest. No supportive care needs being vocalized doesn't necessarily mean that they don't exist. I'll also say that a lot of those themes that you guys beautifully summarized validated the work that we were doing at the University of Toronto in the last couple of years. And the way that we summarized the feedback from men that we worked with was about this connectedness conflict. So talking about feeling disconnected, which we see across young adult cancer survivors, feeling isolated, and that speaks to the developmental stage and what your peers are going through, and yet placing an emphasis on that self-reliance, which you touched on, Jackie, feeling that they were too proud to be pitied, right? They went from being very, you know, healthy and, you know, at that stage where they were exploring the world, and then all of a sudden they're knocked off that conveyor belt of life. And so that conflict is really interesting when we talk about what it means when we're for pride, Jackie, as you asked, but also how we then break that down and allow men to feel that they can connect and engage with other men who've been through a similar experience. So, Paul, what are your thoughts?
I've known a number of guys, and maybe I should probably just speak on behalf of myself. So there is this fear of looking weak, and so there can be a front, but a lot of us, it's ingrained in us that we want to, you know, put our best foot forward, and so it's not so much a front as it is, it's actually quite ingrained in us, and there is a lot of guys can get rather self-conscious, they can embarrass easily, and it does happen. It's not like we're too sort of closed off and rough and tough. It's like the mushy part in the middle, if you want to look at that way. And so, but if we can be around a bunch of guys, like if I could walk into a room and say, "Hey man, what's up?" That's enough of a welcoming to go, okay, I think we can all talk, you know, and that's kind of all we need. That's all I need. And there was something else, somewhere else I was going with this. Oh, so in looking at reaching out to all these programs, that to me was something that was something I needed to take care of. If you want to call it taking care of business, and if you want to call that task oriented, if you want to call talking to a psychologist task oriented, or participating in a study task oriented, and you're taking care of business, then I guess you're kind of killing two birds with one stone. And so that's the mindset that I tend to walk in with, even though I have to dig this stuff anyway. So.
Yeah, this is great. I'm looking at the time here. We've said, all of us at the beginning said, oh my God, we could talk for hours about this. So maybe we'll just have to do part two. But to bring this to a close, we've touched already on ways. So we've spoke really kind of on like flying up there on some of the barriers. I obviously think we have some thinking to do and probably more conversations to have. But what are some of the ways we can work around those barriers? Like, I think you started to speak of that, Jackie. Do you have any ideas?
Yeah, absolutely. I think some of the some of the ways perhaps that I've learned through this discussion and certainly through the brief survey to overcome some of the barriers to research would be to be a lot more thoughtful and tailored about the marketing strategies, for lack of a better word. I mean, it may seem strange to use that term in research, but it is about marketing. It is about getting the word out and spreading the word about research. And so I think it's really important for us to think about what those recruitment messages say, how they say them, and to think about being a lot more purposeful, productive, and being clear about the value of the time invested. So we're looking for your help to do this, and we want to do this with that. And I think being a lot clearer may help be helpful in incentivizing people to participate, because they can justify, well, why would I put my time into this? Okay, I can see how it could be helpful. And I think I mean, we engaged in some tailoring in that we used images of men. We also engaged in targeting in that we used paid Facebook advertising to try to specifically target men. But I think we really need to go much further than that. And the nuggets that we learned today are so helpful for me. And I think with respect to participating in health and community-based programming, a lot of what Anika and Paul have been talking about, and you, Karine, in terms of what seems to be working for men, I think we need to continue to put in practice. And perhaps Anika and Paul can speak more about that, but this notion of doing, this notion of creating environments where men are comfortable just being themselves, and getting around to the business of talking about what they need to talk about, or doing what they need to do, I think would be a really good way to facilitate the implementation of these health interventions.
Yes. And Anika or Paul, in a minute or so, any additional ways to improve and help with those barriers? Anika, let's start with you.
I'll try to be quick and just add to the ones that we've already touched on and what Jackie has already outlined. Male-friendly spaces within the community where we already see men going to, so it's already comfortable and the norm, and then creating that connection by doing well, creating space to engage. A lot of the feedback we got from the studies we ran at the University of Toronto was more time to talk, more time to engage with each other, so we almost focus too much on the doing and not enough on the space to connect with each other. And then I'll also add, just to circle back to the feedback that we got in the questionnaire, as well as what Paul was saying around increasing access and awareness. We've had success in the past because we've been boots on the ground in the cancer center, speaking to Jackie's feedback of, we get the men when we're there in the clinic. And that's how I've been able to recruit thus far. But increasing that access and awareness outside of the hospital setting may involve or need collaboration between the researchers, clinicians, and community organizations, but also in a way that's branded, that is welcoming. We see in older male populations comments about health services more broadly being not really male friendly and inviting. And there was comments about, breast cancer awareness, bright pink. Lots of research has touched on that. So I think more collaboration, increasing awareness, being sensitive to that branding, as Jackie said, and making it a male-friendly environment with space to connect.
Wicked. And Paul, few words?
Well, I would just jump on everything, but what would help to get the word out is just is communicate the message.
Mm-hmm.
I heard about Anika's study through a newsletter in a support group that I was told about. And so I've been around a lot of people who don't communicate well, and things fall apart. And when people communicate, then things seem to go well, or relatively well. So if people are communicating, guys will hear it and they'll pick it up.
This is great. This is a great, beautiful way. I feel like we've kind of touched, sometimes we'll ask you have one message, and I feel like for each of you, we kind of pulled some takeaways, some kind of, well, if some researchers are listening, I know that they will pick some of that. If some survivors are listening, I know they will relate to some of what Paul said. And then for you as well, Jackie, I feel like all of that lines up well. And on my end, I kept thinking, and Anika and I, before we started recording, we were talking about this briefly. Today, we spent this episode talking about men in research, men in care. But at the same time, we were saying, well, right now, and especially in the last year, which is beautiful, there also has been a look at, well, how well are LGBTQ plus community represented in research? How well are people from different race, different color? All of those data are not yet captured always in a way, and we don't reach those populations either. So some of what you were saying earlier, Jackie, is like, how do we promote, speak, ask questions that are going to be relatable so that those who are not necessarily white, straight, Canadian, will still find themselves or see the benefit in taking part in research. I feel like even for us to have the beginning of this conversation focusing on men, to me really opens up all the other areas in care, so in supportive care, in services we offer, but also in research on ways for us to do better. So I guess that's going to be my part. I thank you all so much for coming in today, having this conversation. I'm super grateful. I'm hopeful and hoping that we can do this again and maybe continue to dig deeper so we can really expand how we serve the amazingly beautiful community of young adults with cancer in Canada and their supporters. So thank you a million times. Thank you. And I will leave everyone every Monday. I always take a moment at the beginning of my day to remind myself and those who might need it to just breathe. During your day, whatever happens, good or bad, try and remember to take moments to pause, just breathe, and I promise you it's going to help. It's going to help enhance. If what's going on is great, you're going to feel it even more, and it's going to help. If what's going on is not great, it's going to ground you back. So remember to just breathe. Have an awesome rest of the day, awesome week. Thank you again all so much, and see you all next Monday. Bye.